Good morning. My name is Folashade Jayoba. I am a DMP student at the Brandman University in Irvine in California. This video is an integrative psychotherapy video, and it's going to be based on a 26-year-old female African American. And I'm going to be talking about her case study, her background, and I'm also going to be talking about the psychotherapy modalities that I'll be using to help her out. And also, I will be talking about the psychotherapies as well, and interviewing the patient, and also being able to use these psychotherapies with the patient. Um, Brianna is a 26-year-old African American female. She's a high school graduate, and she completed her 1 year of college. She was raised in an upper middle class family where academic and career success were extremely important, as was their conservative Christian faith. She was the third, or she is the third of five children. Brianna is a good student, hardworking, and somewhat self-critical. She is shy but has several friends and dated occasionally. After graduation from high school, Brianna went out of state for college. She received passing grades for the first year but began to experience auditory hallucinations and delusions. She began to act in bizarre ways and withdrew from people. She was hospitalized at the age of 20 for 1 month and dropped out of college. In the past 7 years, she has been hospitalized 12 times. She has been unable to work and is being supported by SSI. There is no history of psychiatric illness in the family, and her family are generally supportive of her financially. Brianna was discharged from a psychiatric hospital after 2 months of inpatient treatment. Her diagnosis was schizophrenia, undifferentiated type. Her global assessment of functioning at discharge was 30. She lives with her parents, and she takes 500 milligram of Thorazine daily, which she's supposed to, but she's non-medication compliant. Brianna was referred to by her psychiatrist for ongoing psychotherapy as part of her discharge plan to help her adapt to the demands of community living and manage her illness. Cognitively, she is experiencing auditory hallucinations and delusions, as well as frequent cognitions like I'm no good, I can't do anything, I'll always be this way. Effectively, she has a flat effect related to interpersonal situations and tasks on the content of the hallucinations and the delusions. Interpersonally, she is withdrawn and socially isolated. Behaviorally, she's inactive, unable to work or live independently. Brianna's social functioning is significantly impaired by the interaction of illness and her methods of coping. The hallucination and delusions and cognition interfered with her functioning. Her coping methods of avoidant behavior towards tasks and interpersonal situations and the increase in negative symptoms to deal with stress in turn increase anxiety, negative cognition, and psychotic symptoms. The family environment is stressful as her parents cannot comprehend what is going on with her, which has caused a strain in the family relationship. The introduction of this integrative psychotherapy video is that schizophrenic patients they can improve their prognosis and even help prevent their illness chronicity when issues are being addressed on a timely basis. Um, it can only directly address a wide range of patients' health needs, such as symptoms reduction, relapse, and treatment adherence, but also provide a more cost-effective intervention than the standard treatment for schizophrenia. So in the light of this, I'll be utilizing three different psychotherapy modalities to help Brianna manage her symptoms, improve her social skills, and reinforce family relationships. To accomplish this, I will start with cognitive behavioral therapy, CBT, and I'll combine it with social skills training with the CBT and offer family-based intervention. On the CBT, she will be in control of her therapy by setting achievable goals. In CBT, patients will learn old patterns of thinking and behavior and learn new thoughts patterns and how to turn off negative thinking patterns using reasoning and personal development to develop rational and acceptable alternative explanations and interpretations for coping, problem solving, and self-management. This will bolster through the assignments. We bolster through assignments of homework as additional reading and as some practice skills or drills to reinforce the new thinking and feeling techniques. Using the social skills, it will be combined with the CBT. It's known that lack of social skills is one of the major deficits of psychosocial functioning among people with schizophrenia. So when patients with schizophrenia have been equipped with this kind of skills, it tends to allow them to deal with stressful life events and daily hassles. They are proficient in solving their life problems and challenges, and consequently, those life stressors are less likely to trigger exacerbation or social decomposition of their schizophrenia episodes. Social skills training originated from the social skills model of Robert Lieberman. It aims to enhance patients' social competence in terms of interpersonal and communication skills. During this session, these patients will learn goal setting, behavioral-based instructions, role modeling, behavioral rehearsal, corrective feedback, homework to foster generalization of skills. The next one will be family-based intervention, which is a systemic community-based intervention in which patients and the family members will be involved in learning skills as acquisitions. An intimate relationship and interaction between patients with schizophrenia and their family members is important for a family-centered intervention to improve both family and patient ability to cope with the illness. It is also known that critically or emotionally over-involved attitudes and behavior displayed by family members towards their relative with schizophrenia has revealed that family dynamics and emotional climate affect the recurrence of positive symptoms. Additionally, to reduce family burden, family will be encouraged to maintain their own health and well-being. These sessions will provide continued education, caregiving skills, and support to the family. It will include 10 sessions over the course of 9 months for a relatively long-lasting effect, 4 bi-weekly sessions in the course of 3 months, and 6 sessions in 6 monthly sessions in the course of 6 months. So the overall encounter with the patients is that the psychosocial interventions and more initiatives in personalized treatment for schizophrenia will be seen and will be used to address many unmet health needs of these patients with promising evidence. This approach to implementing evidence-based person-focused therapy for patients is patient in need of personalized care is very, very important. The increasing evidence that psychosocial interventions are effective in relieving these patients' psychotic symptoms and improving their functioning. Some of these interventions are thereby recommended. Cultural implications are that the cognitive CBT therapy combined with the social skills family-based therapy intervention together will form an effective psychotherapy intervention for this patient. As an African American, studies shows that the African American race is highly sociable and deeply, family oriented. Applying these techniques will help this client to identify strengths, weaknesses, overcome distortional thinking, stigmatization, and reinforce and improve her familiar current cultural environment, which will result in a positive outcome. Now I'm going to go to the next segment where I'm going to talk to my patients and do a little bit of the skills training and the homework that she will need to do to be able to overcome, the symptoms that she's been experiencing. Good morning, Miss Brianna. Thank you so much for coming in for therapy. Very good, very good. So the last time that you were in the office, we spoke about your the symptoms that you were experiencing, which is mostly, you were hearing voices, and those voices have been, incapacitating you in your daily activities. So I want to try to help you out with 3 different modalities that we'll be working on. And I'm going to start with what we call the CBT. And CBT, like I explained earlier on, is more to help you with those negative thoughts to be able to bring the positive into it. to be able to know what is real and what is not real. So right now, I have a question for you. The question is that the voices that you were hearing, were they commanding voices that are telling you to do certain things?
Yes, and also more of
Negative thoughts like what?
like self-defeating thoughts.
Self-defeating thoughts. Okay, so those voices that you're hearing, are they telling you to harm yourself?
No.
Not really. Okay, all right. So but what do you do when you what have you done in the past to help you with?
I just ignore the thoughts telling me to do anything.
You just ignore it, and
Mm-hmm.
when you ignore it, what does it do? What happens?
They either stop or come back.
They either stop or come back.
Mm-hmm.
But have they been coming back more frequently?
Yes.
Okay. All right. So, well, it's a good thing that you are able to ignore those voices. That's part of the coping skills that I was going to even talk to you that I'm going to talk to you about today. So, ignoring those voices helps, but if you ignore them without doing other things with it, you may not be effective for you. So, my suggestion would be that when you hear those voices, I want you to practice when you go back home, and I want you to try it here with me. Songs. You can listen to music. You can hum songs. And a good one is like Happy Birthday. Do you know the Happy Birthday song? Okay, Happy Birthday to you. Can you hum it to me, please? Very good. If you can hum it like that for 2 minutes continuously, when you stop, you continue, you continue for like 2 minutes, and then you let me know if you still hear those voices or if you don't hear them anymore. Okay. So, but usually when you do that, it helps you to be able to distract you from that voice that you're hearing. So I want you to jot it down in your journal, the time that you hear those voices and what you were doing at that time, and what actually after humming the song, what happened after that 2 minutes. Did it stop? And if you continue to do it like that, that's going to help you, because after some time the voice will come less and less and less frequently, and possibly they will all disappear. You understand? So I also want to add to it that you listen to music as well, and probably take up doing some exercise, you know maybe taking a walk or going to the gym or something to help you control the voice. So that's the cognitive part that we're going to do. We're still going to go into more advanced techniques, but this one I want you to do this for the next 2 weeks until you come back to see me. Then the next one also that I want to add to this is the social skills. I understand that you've been isolated for a while now, and you don't go out, you don't interact with people outside. So the thing that I want to help you with is to do start with the basics. So we start with the small tasks, and then we'll go move on. So the small tasks will be like like an eye contact. You understand? Every time you speak to someone, whether you go out to the mall, whether you are meeting somebody even for the first time, or even that person, you must make an eye contact. That will help you to strengthen you from the inside. So the eye contact is very important. Smiling or displaying your emotions at appropriate times. So, for example, when there is a sad situation and you start to laugh, it's inappropriate. It is not normal. So you have to, you should, express your emotion according to the situation. You live in the now. You understand that? So you do the eye contact, you smile, you do a handshake if that is possible. You learn communication skills like knowing how to ask questions, knowing how to give the right answers. You understand that? So all of those things, I'm going to give you a homework to help you with that. Knowing how to give compliments, knowing how to receive compliments. I'll give you a homework, and when you do that, you bring it back to me in 2 weeks. And the last part that I'm going to discuss with you is going back to the social skills. I want you to practice and practice. Don't just do it one day and leave it alone. You do it continuously for the whole of the day. Continue to do it. Smile. Not smiling when there's nothing to smile about, but when you meet people, when you say hi, when you say hello, smile with it. Learn how to smile. Learn how to do eye contact. So the next one is the family therapy. So the family therapy that I want to involve your parents. And I know the last time I spoke with you, I asked you to go to your parents and talk to them. So what happened? Tell me what happened.
We talk about being able to communicate
Hmm.
better with each other
Okay.
so they can understand bit of what's going on with me,
Okay.
and I asked them if they were willing to come in to some
Mhm.
of the sessions, and they said that they were willing to try.
To try. Very good. Very good. That's a positive step too. Your family is willing to come in with you to help you out because a strong family reinforcement will help you a lot. Will make you understand that you're not by yourself. That you have family who will help you. A good family support will help you to be able to help you with all these symptoms and help you to be able to live a more quality life. So when your family comes in, like I explained to you the last time, I'm reiterating again that it's going to be a longer process than these ones that we're doing. But we will combine the CBT, the social skills, we'll combine it with every sessions. You understand? But it's important that they come in so that they also can benefit from that. I understand that it's very, very stressful on them because they probably don't understand what your symptoms are and why you are feeling the way you are feeling. So this session is going to help them and help you as well. So the family session is going to be into three parts. It will have an area where there will be, it will be like a patient family education where they will be taught about the schizophrenia symptoms, the illness itself, what they should expect, and what is real and what is not real, and how to cope, with situations when they come up for you. So also we are going to train them on the communication skills and also teach them on practice of problem solving techniques and also how to think of solutions and how to apply them to the life situation. So these are all the things that we're going to be able to do in your next session. So when they come in, so you're going to come back again to me in 2 weeks, and in that 2 weeks, I hope that you'll be able to come with your family, and then we'll be able to do this in like it's going to be 10 sessions, like I said. It's going to be 3 months bi-weekly. We'll do three bi-weekly for 2 months for the training, okay, and the communication skills and all of that. And then the last 6 months of it will be monthly, where your family will come in and we will review homework and we'll see how your progress is going. Okay. Okay. So don't forget, you're gonna do what? You're gonna do your cognitive regarding the cognitive behavior therapy. You're going to try to to think more positive self-talk. You can do it. I am who I am. I am beautiful. I'm intelligent. Those are the words that you're going to be practicing. I'll give you all those homework to help you to work on them. Okay. And then on the social skills, you will learn how to do an eye contact with people. you know Smile, shake hands, let there be some sort of emotion. Don't have that flat effect. Try to, overcome that. Practice, 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 right? Do you have any questions for me? Are you sure?
Yes.
Okay, all right. So this is the end of our session. I hope to see you next time in 2 weeks. All right, nice to see you, and
Nice
thank
to
you for
see
coming in.
you.
Bye bye.